You're listening to a podcast of Your Pet Matters with me, Dr. Michael Tokiwa, Saturday mornings at 10 a.m. on 1077thebronc.com.
Dr. T is at your door. Open your home to the #1 pet healthcare show in Mercer County. 1077 The Bronc presents Your Pet Matters with Dr. Michael Tokiwa of the Animal Hospital at Kingston and Blauenberg. Every Saturday morning, Dr. T offers intelligent, informative healthcare talk with just the right dose of bedside manner, exclusively for our furry friends. If you own a dog, cat, or small mammal and have a question about your pet's overall health, call Dr. T now at 877-900-1077. Your Pet Matters is underwritten by the Pet Wellness Professionals at the Animal Hospital of Kingston and Blauenberg. Small hospital, big medicine. For more information online, it's barkmeowvets.com. The doctor can see you now. Here's Dr. Michael Tokiwa and this week's edition of Your Pet Matters.
Good morning and welcome to Your Pet Matters. I'm your host, Michael Dr. T. Tokiwa, and today is a beautiful sunny February day. I'm actually sweating, and I don't remember the last time I was able to sweat or not wear a full winter coat. I wore just a vest today. I think it's awesome. It was a great drive in. I looked at the weather. It says 43 degrees. To me, it feels like 83, and it's awesome compared to last week. So I'm really happy about that. And as always, I always look for unusual holidays, and today is actually Love Your Pet Day, which is it's really awesome because we haven't been live in studio in a little bit, and joining me live in studio is Dr. Kendra Pope. Returning guest, thanks for being here.
Hi.
Yeah, good to see you.
Great to be back.
And it's funny because I'm looking at your credentials from Red Bank, and the last time I talked to you, just so the listening audience knows, she's an oncologist by training. So she's a diplomat of the ACVIM, we call it, the American College of Veterinary Internal Medicine.
Correct.
Yes, I always get my things wrong.
Yeah, there's lots of letters.
and you did a lot of shall we say, traditional Chinese medicine training through the Qi Institute. You got tons of stuff behind you. Herbalist, acupuncturist, food therapist. But lately, the new thing I saw was therapeutic massage.
Yeah.
And I think that's awesome.
Great. Yeah.
That's awesome.
It's pretty much all the modalities in traditional Chinese medicine, like you said. So combining East and West. That
is great. And so for our listening audience, just in general, I think we should backtrack and talk about what is an oncologist for those who need to understand. And then we'll talk about how you incorporate the traditional Chinese medicine into that. And we call that incorporation integrative medicine. I'm sure some listeners have heard or read or seen that terminology. But in general, what is an oncologist and what did it take for you to get to this level?
Okay, sure. Yeah. So an oncologist is a doctor that treats cancer. So, whether they're a human oncologist, a veterinary oncologist, they're a doctor that's job is to address cancer. They can be a medical oncologist, the ones that traditionally prescribe and administer chemotherapy. They can be radiation oncologists, the ones that use radiation. They can be surgical oncologists, the ones that use surgery, which are the major modalities. For me, when it says a boarded oncologist, typically that means that you're a medical oncologist and you've gone through veterinary school, so you're 4 years of school. You've done one minimum of a rotating internship. It's getting more competitive these days, so people are having to do more than one. And then you do a usually 3-year residency program, and then have to take really big quizzes and pass them and publish.
Really big quizzes.
And then
it's like a doctoral thesis. Right?
Exactly. And then you can obtain your board certification. And you can, pretty much you are considered to be the most informative person to kind of handle all these cases.
So what drove you to, as you pointed out, so there's different specialties within the profession. You'd be a surgeon, ophthalmologist, skin specialist, dermatologist. So what drove you personally towards oncology?
Sure. That's it's a question that is a bit personal and then a bit something that I thought would be a great challenge. So I'm sure many people in their lives have unfortunately experienced someone in their family that's had cancer, and I had a similar familial experience, and it was one of those things where I was left like I couldn't do anything to help. And it was kind of during the same time that I was choosing what I wanted to do in the veterinary field, and I kind of realized that it was an opportunity for me to connect with my clients and maybe provide them some empathy that I maybe couldn't in other situations. And so that's what drove me to the oncology piece, and then really wanting to be able to offer those patients all the tools in the toolbox is kind of what brought me to the integrative medicine side.
And that you're not atypical of many of the guests where there's a life-changing event that leads you to either the decision to become a veterinarian or to channel you down that life's road. And I'm sorry that things happen to you. Statistically, I find that 1 in 4 of us are going to face the cancer risk and so forth. And,
Right.
And yeah, I understand what you went through and so forth, things like that. But that's great. I think that it's great that it brought you here.
Yeah.
It's great to have you here and so forth. And so let's talk about how you got interested in Chinese medicine.
Yeah, it was, I feel very lucky. I feel it's so funny, people that are, they consider themselves energy workers or healers or whatever. They have some funny moment where they're like, oh, it called to me, one of those weird opportunities. But I think it happened. I was at the University of Florida, which is one of the only vet schools that has a really strong acupuncture integrative medicine program. And I was there for vet school and exposed to it very early in my curriculum. We had courses, we had electives, we had rotations to take. And so very quickly I realized this was the niche that I was looking for. My second year in vet school, of course, it's the year of all the exams, you're staying up late, you're not sleeping a lot, and I actually started developing chest pains. And I was seeking out ways to kind of mediate that without, the traditional pills and things. And I found acupuncture and it took them away immediately. And I'm like, man, there is something to this. So I just couldn't stop looking into it. And then once I did, I got hooked.
What was the very first patient you treated with acupuncture? What was
I think it was my own dog because I probably was taking my course and I went home and started poking him.
He's going, ow, that's not the site.
Exactly. And when he sees me get my needles, he kind of sulks away because he knows that I'm coming at him. But yeah.
Well, how do you feel about that? So there's different levels. There's the actual just putting the needles in themselves, and then you could heat them.
Yeah.
You could electrical stimulate them,
Yep.
and you could do laser therapy. So what is your take on all those types of approaches?
Yeah, they are all different ways to basically stimulate the acupuncture point. If you ask like my mentor, he basically said he went to vet school in China and he said, when he was in school, they just had to sit there and spin and spin and spin and move them and move them.
Clockwise or counterclockwise,
exactly.
Right? Open and close, open and close. Yeah.
Right. And so now basically we don't have to do that because we have all these conveniences. So there's a lot of great different ways. I think that the heating them, I've had that done, and personally for certain conditions, it's awesome. It feels really good. It's kind of like this deep warming sensation. The electro is great because if you have pain conditions, back disorders, disc disease, anything where you need a greater endorphin release and a different endorphin release, it can cause that. And then laser is awesome for patients that they don't tolerate the needles. They try to eat you with the needles. And even aquapuncture is another way that you can do it where you can inject things like B12, saline, Adequan, and it's kind of a more longer lasting type of treatment.
Adequan? You inject Adequan
into acupuncture sites. Yeah, so those old creaky dogs with arthritis, they get a little bit of here and there. They're good to go.
Oh my God. Okay. We have to talk after the show.
Yeah.
But when we backtrack, so for our listening audience, just the concept of acupuncture, if you can just generalize the whole basis of that and how it translates to your pet.
Yeah, absolutely. So it's the practice of placing very small needles much smaller than used to draw blood, in specific points along the body. Those points are typically either clusters of nerves or along nerve roots, and they are found along what's called meridians or channels on the body that are used to basically allow energy to flow. And in Eastern medicine, if you have pathology, if you have pain, if you have imbalances, you have blockage of that energy, and basically acupuncture is used to release that.
And so the whole exam is different as well, right?
Yeah.
So if you walk into, why don't we use arthritis, because that's a very common thing for acupuncture. You walk into the arthritic pet, and what are you looking from an Eastern standpoint? What are you looking for physically? And I know you have to look at the tongue and everything like that, right?
Yeah, so definitely the two most important things from an Eastern exam is your tongue and your pulse. And I've noticed it myself. You probably appreciate when you have a cold and you look at your tongue, you see that like nasty white film on it. So in Eastern culture, your tongue is really a reflection of your soul. And so you look at the color, you look at the thickness, the shape, if there's any coatings, the moisture on it. And all those tiny little differences can really help you to differentiate where, that pathology in that patient is. The second is their pulse quality. And as a Western practitioner, you're like, oh, that makes sense. Is it strong? Is it weak? But really, it's about tiny little nuances. Is it stronger on one side than the other? Is it superficial? Is it deep? Do you feel like you can appreciate any changes in the texture that maybe could represent other thing that's going on? So it's mostly the tongue and pulse, which is really cool.
And then how do you approach that, the patient? Do you actually do both Western and Eastern philosophies, or do you just I guess it's up to your client too what they want to come in for, right? But
yeah.
But when you're brought into that situation, what kind of response and approach do you take?
Yeah, I think that for the majority of my patients, and if I'm able to, which I think that I am for most, I am an integrative practitioner and I can't help but do it all. I'm in the room and I'm taking my history, and when they're panting at me, I'm looking at their tongue. And then I do my Western exam, but then I'm also feeling along the meridians for sensitivities. And then, I'm sculpting their heart and I'm taking a pulse, but then I also do a two-handed, feel of their pulse, and I feel for those qualities also. And so typically speaking, it really allows me just an extra tool, and it gives me more information than I already have to kind of help the patient.
Okay, so let's talk about that integrative approach. And I think it's something that when I first met you, I think it was starting to really come out. And now it's almost, I don't know a single journal that I don't see integrative medicine as part of the concept and stuff. So why don't we talk about your oncology approach and how you use that Eastern philosophy to help with that. And we only got a couple minutes, so we'll start talking about that when we continue after break. But
basically, integrative medicine is just truly combining all modalities that you have accessible to you to allow to help the patient. Focusing on everything: your body, the mind, the spirit, the soul. All of those things is truly just integrating all treatments that you have. And so there's a lot of things that can be done, but typically, for most patients, it's a combination of acupuncture, nutrition, herbal supplements, and then, maybe the Western treatment too.
Great. So we're going to take a little break. After the break, we're going to talk about bad pet sitting. Is that correct, Matt? Bad pet sitting, Matt's Pet Project. And we'll continue our great discussion with Dr. Kendra Pope. You're listening to Your Pet Matters on 1077, 1077thebronc.com.
Your Pet Matters, Saturday mornings at 10 on 1077 The Bronc, is underwritten by the Animal Hospital of Kingston and Blauenberg.
This is 1077 The Bronc News. We have two breaking stories in Kingston and Blauenberg, New Jersey. Megan Azar is on the scene.
Thanks, John. Seemingly out of nowhere, dogs and cats have flocked to the Animal Hospital of Kingston and Blauenberg. We interviewed Max the dog to see what his thoughts were. And now through our dog translator.
At the Animal Hospital of Kingston and Blauenberg, Dr. Michael Tokiwa and his team of specialists customize medical treatment for each pet's needs. A full-service veterinary facility that practices big medicine in many ways that are better than chasing my tail.
We also spoke with Mr. Fluffykins, a cat. And now translated.
Dr. T and his specialists are my life partners in medicine. They have an altruistic passion for pets and their well-being, even the small mammals. I, as a cat, normally chase, have their own specialist. What could be better?
Choosing a veterinarian can be the most important decision for your pet, and these dogs and cats sure have the right idea. The Animal Hospital at Kingston and Blauenberg, your other family doctor. For more information, go to barkmeowvets.com. Back to you.
Everyone has a weekend project, and our producer, Matt, does too. It's time for Matt's Pet Project, your source for current pet news, recall alerts, adoption services, and helpful tips and tricks to make sure your pet is as safe and healthy as they can be. Matt's Pet Project is underwritten in part by your other family doctor, the Animal Hospital at Kingston and Blauenberg. Small hospital, big medicine.
1077 The Bronc and 1077thebronc.com proudly ranked the 15th best college radio station in the nation by the Princeton Review, live from the Colonies Public House studios. I am Matt, and this is my pet project for today. If you guys want to join in, feel free. I won't be able to hear you because we are currently training future producer Jackie, and she has the headphones on. So I'm just going to keep going so Jackie punch me or something and let them know when to stop. So this normally I wouldn't cover something like this because it's in Texas. And that's not bias against Texas, it's not in New Jersey. And it's kind of ridiculous, but that's why I want to cover it. So this couple, they're piano teachers, and they live in Texas, and they needed, I guess they're going on a trip or something, and they needed a pet sitting service to watch their dog and to watch their fish. So they met with this service. Let me find out if I can find out. Okay. So their normal pet sitting walking company was closed for, I guess, like the weekend or something like that. So they needed to go to this place called Prestigious Pets, and they needed to obviously get them to walk their dogs. So they went to this first meeting, and they got like a bad feeling because the hours that the company had was Monday through Friday, 9 a.m. to 4 p.m., and Saturday, 11 p.m. To 11 a.m. to 3 p.m., and they were closed Sunday. And that's a lot of time that your pet, especially dogs, aren't getting any notice or getting any care or anything like that. So they were like, okay, this is kind of weird, but they were like, all right, fine. So they let it happen, and they went and looked on, like, I guess this camera that had it locked on the tank so they could look at their fish. And they noticed that the water was dirty, and then later they had some problems with the invoice. So they're having all these problems, and they were like, okay, so they left a 1-star Yelp review. And they're like, wouldn't suggest. And they are now being sued by the company for $6,700 in damages. And the company's alleging that these people violated a non-disparagement clause in the contract they signed. So that's really, I mean, what do you guys have to say about this?
That's crazy.
It's funny because I went to their website. You get $10 off first-time clients, so maybe it's only being sued for $6,600 or things like that. But I'm kind of torn about reviews. I mean, clearly, if you're going to have cameras in your business, you better have good quality service if you're going to allow people to do things. I can't speak for truly whether this place is not up to snuff or not. But it clearly, if you're providing your clients accessibility to the site and it doesn't look good, that's something you should definitely address. But to sue is if we screw up. The biggest thing for us as veterinarians is client communication and being honest about things. And, I think there's not a medical profession out there who isn't worried about having a potential legal issue with a client if something happens. But the just and true way of doing things to increase trust and eliminate any lawsuit is to be open, upfront, and honest and keep the communication lines going. To turn around and get hardlined, it's funny. What I will say on behalf of the people being sued is that I'm looking at the Google reviews, 2 stars out of 5. So I think they're not alone in this.
It was the 1 star that did it. 2 would have been fine, but it was the 1.
And to defend the company about online reviews is I personally don't look at online reviews because you could have an angry individual for whatever reason. They could have had something out for any business on the front and write a bad review. So the way we manage things are that every appointment, 2 days after every appointment, the client gets an email asking to rate certain aspects of that, and we get a printout of it. And I take that to heart. So things that, at my practice that I need to improve is the waiting time, things like that. But I want an honest answer. And if someone comes up with a serious, legitimate concern, that is addressed immediately. And we try to work things through that. But online reviews, I mean, you could have people, from a bad sense, is you could have people that are your friends and family writing fake great reviews for you, or you could have someone who's angry and writes one bad review. And I find that it's difficult to start a battle with that. It's not worth it. So
yeah, I agree. It's way too easy to do online reviews. So for them to take it and get so angry about it, it's a little bit nuts because everyone will do. And you're absolutely right. There's a certain type of person that will do a review, and it's either, like you're saying, ones that have an investment in the company because it's family or friends, or they're super angry. The people that just go about their day being happy about it, they're not going to go on and make a review.
Yeah, it's not worth it. But you don't sue. This is not the approach. You're going to create a bad effect. And clearly, I think this is going to be the way social media is today. I mean, it's the first, like, when I Googled the name of the business, and the first thing is pet sitter sues Texas couple after bad Yelp review. This is not good. I don't want something like that. If someone searches Dr. T, Dr. T suing client for bad review, I don't want that. That's my number one.
They say any PR is better than bad PR, I guess.
Yes.
Whatever the phrase is, but I don't think that's always true.
Yeah.
But it could really be detrimental for the business. Yeah. That's interesting.
All right. Well, that's all for my pet project for today. We're going to take a quick break, and we'll be right back with more of Your Pet Matters after this.
That's all for Matt's Pet Project. Tune in next week for more pet news and alerts only on Your Pet Matters. Matt's Pet Project is underwritten by your other family doctor, the Animal Hospital at Kingston and Blauenberg, your pet's life partner in medicine. For more information online, it's barkmeowvets.com.
Your Pet Matters, Saturday mornings at 10 on 107.7 The Bronx, is underwritten by the Animal Hospital of Kingston and Blauenberg.
This is 107.7 The Bronx News. We have two breaking stories in Kingston and Blauberg, New Jersey. Megan Azar is on the scene.
Thanks, John. Seemingly out of nowhere, dogs and cats have flocked to the Animal Hospital of Kingston and Blauenberg. We interviewed Max the dog to see what his thoughts were. And now through our dog translator.
At the Animal Hospital of Kingston and Blauenberg, Dr. Michael Tokiwa and his team of specialists customize medical treatment for each pet's needs. A full-service veterinary facility that practices big medicine in many ways that are better than chasing my tail.
We also spoke with Mr. Fluffykins, a cat. And now translated.
Dr. T and his specialists are my life partners in medicine. They have an altruistic passion for pets and their well-being, even the small mammals. I, as a cat, normally chase, have their own specialist. What could be better?
Choosing a veterinarian can be the most important decision for your pet, and these dogs and cats sure have the right idea. The Animal Hospital at Kingston and Blauenberg, your other family doctor. For more information, go to barkmeowvets.com. Back to you.
A healthy pet makes for a happy home. Let's try to make your pet's home the happiest out there. Welcome back to Your Pet Matters with Dr. Michael Tokiwa of the Animal Hospital at Kingston and Blauenberg. Listen to Your Pet Matters online at 1077thebronx.com or via your smartphone. Search and download WRRC1 in either Google Play or the Apple iTunes Store.
Welcome back. If you're just joining us, my special guest today is Dr. Kendra Pope. She's an oncologist for our friends at Red Bank Veterinary Hospital, and she's also integrative medicine. When we'll be talking about the difference between Western and Eastern approaches and how the Eastern approach, things like acupuncture, can really help the Western approach to medicine. But during the break, we were talking about just your field in general, and there's a lot of discussion out there in the vet profession about compassion fatigue, et cetera, and in your specific area, I know there's got to be a lot of hand-holding, a lot of client interactions, because they're dealing with, one of the worst disease processes pets can go through, cancer diagnosis. But let me clarify, though, that Dr. Jenny Kim always says cancer is not a death sentence, and I love that. I love that statement. And so there's a lot that can be done. I'm seeing on a weekly basis new approaches towards cancer treatment in both the human and pet world and so forth. And I always tell my clients and the listening audience out there is that if your pet gets diagnosed with cancer, usually it's your primary care physician like myself that does the diagnosis. But I always say, no matter what approach you want to go to, is definitely give someone like Dr. Pope a call. Have a consult with an oncologist, because they do this 24/7 and they know the latest approaches, and they can give you the best answers about what each type of avenue you want to go down can lead. And it can range from full treatment, it can range from partial treatment, it can range from no treatment, but you want to know what your options are. And I think that they're the best way to give you that idea of what the pros and cons of what avenue you go down is. And I really stress that it's not, it's never a death sentence when we diagnose cancer. There are always options available to you. And some of the cancers we diagnose are like for some skin tumors, we remove them. Hey, we're good. We're good to go. But I always say, have a discussion with an oncologist so you know what your options are.
Yeah.
But talking about cancer, talking about what the client has to go through, talking about what you have to deal with, because you're dealing with a lot of times it can be chronic palliative care. There's a lot of stress involved. And in our profession, there's a lot of financial issues involved. You know, when you start going down the road of oncology treatment, it can lead to thousands of dollars of therapy. But so how do you deal with that? How do you balance that?
Yeah, and I definitely am no expert by any means, and starting my career in the last few years, it's still something that I'm learning to manage. And I'm sure general practitioners, all veterinarians as a profession, we all are at high risk for compassion fatigue. And, I think that I'm still learning ways to do it. But I think we were talking about this a little bit before the show today, is that you have to have other things in your life that bring you joy. And you have to have other things in your life that recharge you. Because if you're always working with an empty bucket, you don't have anything to give. And so you always have to be refilling that bucket. And so, I try really hard to have many other things in my life. I try very hard to get out on time and try not to stay too late doing records so that I can go to yoga class, or I can go home and cook dinner because I like to do that, or whatever it is. And, remove yourself, having friends and family and the things around you that, recharge you.
And our pets help that as
Absolutely.
well.
They definitely
the
do.
The best therapist is the pet.
Absolutely.
they don't judge you.
They don't.
Just give me food, let me out.
And unconditional love. Yeah. They have no conditions for that.
Yeah, I'll love you. I don't care.
Yeah, exactly.
You got bad breath? I don't care.
Right? You had a bad day. It doesn't bother me. You're in a terrible mood. I still want to lick your face. Yeah, absolutely. I agree.
No, and that's great. But why don't we talk about how the integrative, why don't we use a specific case? Is there a specific cancer case that you treated that you saw a huge benefit of taking that Eastern approach and adding it to the mix?
Yeah, I think that there have been quite a few patients, even in the past few months, that, my oncology department is very supportive of it, which is very helpful, because I think the biggest obstacle to helping these patients is just education and owners knowing about it. And so, I appreciated your comment very much about go talk to an oncologist, because it's true. If owners don't know that it's available, whether it's conventional treatment or integrative treatment or complementary, whatever it is, that we can't help them. So the first step is education, both of our colleagues and then of our owners. But I think that there have been many instances where, although the integrative option may not add quantity to their life, the goal for me and where I think I succeed the best is in the quality of life. I think one of the biggest obstacles for why people are unwilling to come see an oncologist, and probably what you have to counsel people through a lot, is that they assume it is a death sentence, like you're saying. And they assume, they see images of human cancer patients. They see, people that are going through chemo or radiation and see that they have no quality. And although as a veterinary oncologist, we do much better than our human counterparts of providing that, we still fail in places. Lethargy during treatment, maybe their decreased cell counts during chemotherapy, maybe pain during radiation therapy, or pain associated with masses, or appetite, or anything, or even nutrition. And so those are all avenues where, although we are doing our best with all the tools we have to treat their disease, we aren't taught to counsel our owners on nutrition or on exercise or pain management outside of using medications. And so those are really all the opportunities for me to benefit the patient that would be left untreated otherwise.
No, and that's great. And I was going to say at the beginning of the show that when I look at your credentials, you are the jack of all trades, because you can bring that in. You can bring the food, nutrition. You can bring herbs in. I mean, I won't even go near herbs because I don't know. I don't know what to say to a client. It's something that for that alone, Dr. Relevant, and go from there. But you can look at the whole body and see what's going on. And it's interesting because another one of your colleagues, Rob Gillette.
Yeah.
And I've referred a few patients to him post-surgery. Yep. So a friend of mine's my boarded surgeon. He comes to the practice. Dr. Ting, he's been on the show a few times. He comes in and he'll do a cruciate repair. And then I'll talk to the client about going to see Rob. Because Rob not only does the physical therapy, but he talks about the pet's lifestyle and nutrition and everything like that. And I think that really makes a significant difference in recovery time and quality of life.
Right.
And you brought a good point about quality. I think that in general is many clients refuse to even go down a cancer treatment approach because of personal experiences, usually with human friends or family members that they've seen, what we do in the human world. And I always say in the human world, they kind of just keep going.
Right.
You know, we're going to break you down and build you up, and there is no stopping. The two ways we stop are that it's not going to be effective or that you're cured and in remission and you go your way. As in the pet world, we concentrate on quality of life. The goal immediately, clearly, is to get remission, but it's a quality of life approach, and you always have the opportunity to stop. You know, you're not forced to go down a road that you just can't turn around on. And I really find that by discussing those avenues with oncologists like Dr. Pope is that you get a good flair of what's going on. But to add the Eastern approaches to do the pain management, because there's many pain management meds we can't give to cancer patients, or like, for example, if they have liver tumor, you don't want to give Rimadyl, our standard dog aspirin, to a patient that way. So you get a lot of different opportunities to do that. But why don't we talk about like nutrition and herbs? What sort of approach do you take from a Eastern approach?
Sure. So the food part is really I love that part about it, because I think that I'm really fortunate that I'm at a private practice that has board certified, clinical nutritionists.
Yes.
And so we can do it in a very legitimate way, which I find very exciting. So basically, Eastern perspective, all food has energetic properties, whether they're warming or whether they're cooling, whether they're, they tonify blood or, some other property. And, we all understand that food is medicine, and what we put in is important to what we get out of our bodies. And so that principle is then translated to a cancer patient and used to allow them to get everything they need out of their diet. So typically, foods, for an example, a patient that maybe is anemic, maybe has a weak stomach, is nauseous from chemotherapy treatments or their disease, or maybe are a little bit hot because these chemotherapy treatments sometimes can mess with their body to regulate their temperature, or prednisone, they're panting all the time. And so you can use food to kind of balance those out. So you pick things that are gentle on the stomach, easily digestible, maybe some cooling foods, maybe some foods that are tonifying to their blood to help with the anemia, and you really can just tailor it to exactly what they need to be as strong as possible to go through their treatments.
For example, what is a cooling food?
Yeah, so spinach is cold, cucumbers are cold, watermelon are cold. Proteins that are cooling are turkey, duck, rabbit.
So what's a hot protein?
Chicken and lamb are very, very hot.
Interesting.
Mm-hmm.
And what about hot veggies or hot?
Hot veggies, kale is actually warming, which I wouldn't have thought. I thought it would be cool.
Everyone's on the kale bandwagon right now.
Yeah.
Okay.
If you cook your sweet potatoes, they can be very warming. Think of like that bright orange red. That's a warming food. Things like ginger is warming. Radishes are warming. So foods that you're like, when I taste them, I can feel that burn a little bit.
No, that's great. I need cooling foods.
Yes, most of us do, because most of us are high stress and high anxiety. So most of us do.
Is there any talk? I know it's not for the pet world because it's toxic, but is there any talk about coffee in?
Oh yeah.
Oh, so what? I guess it's a hot.
It's hot and it's energizing. And my Chinese medicine practitioner always said, "No coffee, no coffee." And I'm like, "No, I'm sorry, I have to have it in the morning." So probably most of us don't.
Is there an acupuncture point you can use in lieu of coffee?
Probably, but I still don't think it works as well.
Can you take it several times a day?
Yeah, exactly. I know. Yeah, I remember doing that in vet school. There is a point right on your elbow crease that's for energy, and right before exams, when I'd be up late, I'd be poking myself when I'd go into my exam, and people would just be looking at me like, "Oh, Kendra, she's just poking herself again." So
that's awesome.
I guess that's the coffee point.
What's your favorite type of needle? Do you like the traditional?
I do. Okay. Yeah, I just like the regular, silver, tiny little, needles that you just use without anything special. I actually just took an advanced acupuncture course a couple weeks ago, and he challenged all of us to try some different techniques where we just are very quick and we have strong intention and kind of go about our way differently than I usually do. So I've been trying to be speedy.
And what's the benefit of being speedy?
Basically, he wants you to have an intention, set it, do it, and move on. Not think about it too much because you know what you're doing and just trust it.
You'll second guess yourself.
Mm-hmm. Exactly.
Okay. No, I understand that.
There's an art to this.
Yeah.
It's not as much science as it is in art, Chinese medicine, and so he just wants you to trust in that process.
Okay, no, that's a great training program. Mm-hmm. In the next few minutes that we have left, why don't we talk about herbs? So how do you use herbs and I guess it'll just be a general question, in general for what can herbs do and how do you utilize them for the pet?
Sure. So most herbal formulas and supplements in general are usually derived from some plant compound. So even a lot of the medications that we use even conventionally and in chemotherapy, these are derived from plant products. So a lot of them all go down to the properties of the plant and the potential medicinal value of them. Each plant has a different function or potential healing property. And so the herbals and the supplements are used for those same kinds of things. So whether that be an arthritic dog that it's used to relieve pain or discomfort, or whether that's a cancer patient that it's to help with nausea or diarrhea, it's basically just botanicals that have different purposes that can help with treatment.
And are herbs something that you continue? Like, is it a one-shot deal, it'll work, or you have to do it for X amount of time? Or
Yeah, kind of both, and it depends on the condition. I find that the majority of the patients, when there is a pathology and when there is something wrong, they're on those herbals until we can resolve that. And if it's a chronic disease, then they typically are on management of different things for their lifetime.
Okay, and I think it's a great opportunity to talk about, and we talked about this during the break, is that where you get these herbs from is important. And I think the general consensus is you do get what you pay for.
Yes.
So if you find something online that is much cheaper than what you're getting quoted for something, there's probably a negative reason for that. And I think that applies to all supplements.
Absolutely.
I think generic drugs is a different sort of ball game to go in, but I think for herbs and supplements, I think you really have to have a great discussion with your veterinarian about what their recommendations are, because some of the stuff that's on the shelf at your local drugstore or food store is probably not up to snuff for what you need for your pet.
Absolutely. And people need to remember that there is no regulation on any of those products. And so, they may think it's safe because it's in the store, and that's not true at all. So you need to feel confident in the products that you're getting, because you can do harm. You can do damage to the liver, to the kidneys. You can be administering toxic components if they're not high in quality assurance. So it's very important.
Okay, that's great. And we'll take a short break. And after that, hopefully Stephanie Kaluski will be in studio, give us a little hound help. You're listening to Your Pet Matters on 1077, 1077thebronc.com.
Your Pet Matters, Saturday mornings at 10 on 1077 The Bronc, is underwritten by the Animal Hospital of Kingston and Blauenberg.
This is 1077 The Bronc News. We have two breaking stories in Kingston and Blauberg, New Jersey. Megan Azar is on the scene.
Thanks, John. Seemingly out of nowhere, dogs and cats have flocked to the Animal Hospital of Kingston and Blauenberg. We interviewed Max the dog to see what his thoughts were. And now through our dog translator.
At the Animal Hospital of Kingston and Blauenberg, Dr. Michael Tokiwa and his team of specialists customize medical treatment for each pet's needs. A full-service veterinary facility that practices big medicine in many ways that are better than chasing my tail.
We also spoke with Mr. Fluffykins, a cat. And now translated.
Dr. T and his specialists are my life partners in medicine. They have an altruistic passion for pets and their well-being, even the small mammals. I, as a cat, normally chase, have their own specialist. What could be better?
Choosing a veterinarian can be the most important decision for your pet, and these dogs and cats sure have the right idea. The Animal Hospital at Kingston and Blauenberg, your other family doctor. For more information, go to barkmeowvets.com. Back to you.
Now back to Your Pet Matters with Dr. Michael Tokiwa of the Animal Hospital of Kingston and Blauberg on 1077 The Bronc and 1077thebronc.com. Coming up, this week's segment of Hound Help with Stephanie Kawaluski of Heavenly Hounds Dog Training in Lawrenceville.
Pet Matters. I was just joking with Stephanie that there's donuts here. She's going, no. I think so. I think you're there, right? Yeah, Matt's saying yes. Matt's saying yes, so that's good. Okay, so Stephanie Kawaluski of Heavenly Hounds Dog Training joins me live in studio, and it seems like it's been forever. Yep. I'd like to congratulate. I know we always joke about your husband on the show, but I'd like to congratulate him.
He's not listening now because he's actually at the gym.
Okay, so then you can say whatever you want about him, but I think it's great that he opened up his new business, and the photos look fantastic. I love that.
Yeah, we're excited.
I love the gradations of the football field and everything like that, and the tractor tires and everything like that. I think it looks great. So congrats on that, and I know you're happy because it means he's at home more.
Yes.
So I think it's going to work out really good. But what do you have for us this week for Hound Help?
So I want to talk about personalities and thresholds and temperaments, and this has been on my mind a lot because.
Wait, are we talking about pets or people?
I know. Well, it's kind of the same, and that's part of the conversation here. Just like people, dogs are different, and so I'll get clients that have had multiple dogs, in their lives. And sometimes it's different breeds. Sometimes it's different shelter dogs. Sometimes it's even dogs within the same litter, right? They have
no
multiple
two are
dogs.
alike.
No two are alike. And that's my point. A lot of the times people will say, I don't understand my last dog, X, Y, or Z. We could do this to them. Or if we're talking specifically about interactions with children and dogs, that's always something that's on my mind a lot because I experience that on a daily basis, having 2 dogs, having 2 kids. And a lot of our clients, we have a lot of families that come through our door. And I get that comment a lot. But, my kids with the last dog, they could climb all over him and he didn't make a peep and he was fine. And, this dog just seems a little bit different. And one, I think we tend to forget that dogs have emotions and feelings and preferences, likes and dislikes, and they have different thresholds. So some dogs are going to put up with more than another dog, even in the same litter. No 2 dogs are alike. I have 2 sisters and all 3 of us are drastically different. I'm guilty of comparisons, right? With my own kids, with my own dogs. It's human to do that. But we do have to remember that they are individuals and we do expect a lot from our dogs. We expect them to put up with a lot. And we have to ask ourselves, how fair is that? Because they are, again, going to have those likes and dislikes. And think about it from your dog's perspective. Would you really feel comfortable getting climbed on all day to the point where you shouldn't say anything? You should be able to tolerate anything. People pulling on you, pushing you, you want to get from point A to point B. I'm going to grab you by the collar and take you there. I mean, dogs really do put up with a lot and we expect them to, I think. And a lot of the times it's a little unfair, if not a lot unfair.
I have this memory of my previous dog, Sonny. He was just lying there and my second cousin's daughter, she was like 1 at the time, and he's looking at me outside the sliding. I'm in the backyard, it was the summer, and I just see her go, boink, poke her finger in his eye, and he's just looking at me like this. He's totally taking it. I'm going,
like, oh my gosh.
What a saint. He's just like, he's squinting looking at me. But absolutely.
Right. And I think it's really unfair and really unrealistic to think that our dogs will or should put up with anything. And, it's not to their it's not a fault of theirs. We shouldn't think of our dogs any less because they are less tolerant of something. And I was working with a client a couple weeks ago, and they have a really beautiful pit bull that they just got off of the streets of Trenton. We don't know this dog's history, and really beautiful dog. But they had been doing a lot of aversive type training before I got to them. Lots of pins, lots of shaking, lots of, coming from we have to be dominant. We have to. So the dog had been taking it. And then the dog was laying down on a comfy blanket and they wanted to move it. And they went over to grab it to move it. And the dog turned around and bit him on the arm pretty severely. And, that I think is just, we call that kind of stacking, like trigger stacking. It was just one after another, after another, after another. And to the point where the dog just goes, I'm done. We had reached their threshold. And some dogs, they never reach that threshold because unfortunately dogs don't live as long as we do. So every dog is capable of being pushed beyond their limits, but sometimes we just don't always see it. So, you just have to be aware and think of what is your dog's temperament? What is your dog's threshold? And we don't want to push them to that edge.
Well, you've got me wondering. So you're in now with that dog, and is this reverse? Can you reverse whatever the previous training did?
Reverse is an interesting question or an interesting concept. I think that you can do other things then to regain that trust and build that trust between the owner and the dog. And I think that it comes down a lot to trust. And so I think that you can do things to help it. Can you ever erase the past? Probably not. But what's really good about our dogs, and that's why we love them, is that they really do live in the here and now. And not to say that they don't have histories and they don't sometimes have baggage, but you can do things to improve that relationship, and a lot of things to avoid having that happen again. So improving and then avoiding through management and through, using different methods. And even in a situation like that, instead of moving the dog, because we move dogs a lot. And I see this with little dogs. Little dogs get to the point where they're like, just stop picking me up and moving me. Just
Paris, I don't want to go in that.
I know, oh my gosh, they're going to move me again. So you get a lot of dogs that start reacting when you go to touch them or move them because they're just done. So I tell my clients, let's teach them to move themselves. If you want them off of the couch instead of physically moving them, let's train them to get off the couch when you'd like them to get off the couch. And we can call it off, and they learn to hop off versus taking them off, pulling them off. So lots of overhandling going on, I think, and just lots of, again, just kind of moving the dogs around and pushing them around until they're just done. So my point is, let's start respecting the dogs a little bit and respecting their space and realizing that they are living beings, and teach them to do things on their own and teach them that they do have choices. And that's when dogs really start reacting, when they feel like those choices are taken away. So teaching them that they do have a choice, and when they make the right decision, it's a rewardable behavior. And so I do a lot of, with my kids, going back to the kids, if I see my kids going to do something to one of the dogs, and really this is now for my 1.5-year-old toddler who's wandering around and wanting to pull tails and lay on top of the dogs, I can't necessarily say to him, stop. I mean, I can, but does he do it all the time? No, he's 1.5. So what I'll do instead is call the dogs over to me quickly. So I'm saying, I don't know what he was about to do to them, but I'm not going to wait and push that threshold again. So I'm not going to wait for it to happen. I'm just going to call the dogs over to me, so then we're not pushing and pushing and pushing beyond what they can handle.
Oh, that's great. And I really want to emphasize the point that had the pit bull owners contacted you first, I think there wouldn't have been an issue.
Yeah. Hopefully.
Yeah,
I mean,
so.
you don't know, but you just don't need to be scary, right, to your dog. You just need to be fair and set the rules and set the boundaries.
Treat them as equals.
Yeah.
Treat them as equals. Great advice. Well, thanks a lot, Stephanie. Well, I hear the closing music. The time has flown. So Jackie, thanks for sitting in and learning and shaking. And yeah, we got acupuncture. Don't worry. And I'd like to thank my special guest, Dr. Kendra Pope, for being on the show. Love to check in with you in a few months.
Absolutely.
See how things are going.
It was
Come back
awesome
in
to be
and
back.
we can go from there. And it was great seeing Stephanie live in studio today. So it was a great show. And everyone, enjoy the weekend. But remember, love your pet like they love you unconditionally. Have a great day.
Thanks for inviting Dr. T into your home this morning. You've been listening to Your Pet Matters, the #1 pet healthcare show in Mercer County. Your next appointment is scheduled for next Saturday at 10 a.m. Tune in to hear Dr. Michael Tokiwa of the Animal Hospital at Kingston and Blauenberg, along with his expert guests as they share their knowledge and experiences. There's never a charge for this visit. Dr. T's advice for a happier, healthier pet is free every Saturday on the Bronx. Your Pet Matters is underwritten by the pet wellness professionals at the Animal Hospital at Kingston and Blauenberg. Small hospital, big medicine. For information online, it's barkmeowvets.com. And don't forget to like the Animal Hospital at Kingston and Blauenberg on Facebook.